I'm on surgical nights, and you wouldn't believe what I had to do at 3 a.m. Hey, what's up, guys? It's Confessions of a Doctorholic with Dr. Slayman. I don't know what it is about nights, but honestly, it gives me the creeps. For all the wrong reasons, to be honest. It's not that the hospital looks creepy at night. It's a bit quieter, but it's more my mental state. There was a show on Netflix, it's called Awake. I highly recommend you watching it. I mean, not for the exciting factor, it's just so interesting. They keep people up, I reckon it was 72 hours, and they see how they fare. And basically, they tell you a little bit about how their cognitive skills decline, and there's so many things that they do that's just not right. As a result, I tried to prepare for my nights. So I tried sleeping in, and I'm an early bird all the way through. It is so hard to sleep in. Either way, listen, 7:50 hit, and I'm in the handover room. And basically what happens in this room is the day team, so people who are working from 8 a.m. to 8 p.m. come to this room, and they meet with the night team, which is all of us that start from 8 p.m. and are meant to end at 8 a.m. And they hand over tasks to us. So there are things like the most sick patient on the ward, what we need to do we need to monitor them regularly, what they've done to stabilize them, any surgeries that are happening in the middle of the night. And for junior doctors, things like, this patient, he's a pre-op patient, their bloods need to be followed up, or someone's scans need to be followed up. And that's kind of what you do at night. So there are fewer things that's happening at night because obviously there's fewer hands on deck. But still, it's wild. And by that I mean literally you get bleeped for the randomest things. So the night started, it's pretty chill, I'd say. I've already told them that it's my first set of nights. So they're a little bit more understanding about it. I feel like sometimes people get a little bit annoyed because they're we have half a doctor now because they're not going to know where things are or what to do. But for the most part, they're quite supportive. So night started and they were like, look, don't worry, it's nothing too intense. You probably have to collect some bloods. You possibly have to prepare some patients pre-surgery. But mostly you're just keeping the patients hydrated and happy at night. And if anyone's extremely unwell, then you just need to escalate it to the right people. So, night starts off pretty chill. I got bleeped about 5 times an hour. I wish it was something super exciting to tell you guys, but literally it was, can you please prescribe fluids for this patient? This patient, his cannula got tissued. Basically means it's not working anymore. And half of the time when they do that and they pull out a cannula, it hasn't actually tissued just yet. It just needs a bit of flushing. And usually they did that to me last night. They pulled it out of an IV drug user. And for any one of you who's tried to cannulate this particular patient population before, you would know how absolutely close to impossible it is to get a vein. It's not that they don't have veins. You see them clear as day and you go okay, that's great, I've got it there. It's just they're so fibrosed from the number of injections that have gone in that they're just no good. It's almost worse than cannulating a more senior citizen. Anyway, I'm running around the hospital. I didn't get a wink of sleep. I'm not even joking. Not a little bit of shut-eye. Almost fell asleep in the loo. I went to pee and I just sat there and I reckon I snoozed. I'm almost 90% sure that I snoozed on the seat. Then I woke up and I was a little disoriented. I was ODing on Kit Kat for most of the night. That's what the nurses do. If they want something and they kind of like you. And if you, I feel like I go in there and I'm okay, we're all working on this thing together, so it might as well be pleasant. Yeah, it's not an ideal shift, but it is what it is. Patient care is more important. So we keep bribing each other with Kit Kats. So it's 2:50. I get bleeped from the vascular ward. And the nurse tells me that there's a patient who has severe abdominal pain. And I'm like, okay, like, tell me a little bit about their vitals. Vitals are stable. Just screaming all the time, saying he's in severe pain. Okay, that's no fun. I better go and see it. So I rock up at the vascular ward. And by the way, like with surgery, forgot to tell you this before, you're covering 3 wards, about 60 patients, maybe more, maybe less. But yeah, it's like quite hectic because of that. So I'm up in the ward and I flick through the patient's notes, find out he's a double amputee. He's got a peg tube in, he's got a suprapubic catheter, and that's literally all I could find out about him. So I went to see the patient and he's like leaning forward in extreme pain, like kind of like screaming and going like, oh my God, I'm in so much pain. Oh my God, I'm in so much pain. They've maxed out on pain meds that they've given him. And he's like, so I like speak to him and I'm like, hi sir, I'm the junior doctor on the ward. My name is Hafsa. Whereabouts is the pain? So he's like, I don't know, like, and he's just like literally pointing around his abdominal area, pointing around his genitals. I'm like, okay. I look at his tummy and he's got the suprapubic catheter. It's intact. It's a little bit leaky on the sides, but like I've never inserted a suprapubic catheter. And yes, I know the science behind it, but am I confident doing it at 3 a.m. when I'm half asleep and just trying to function? No. So it was functioning. It was draining fluid out. His suprapubic region, so that's basically like under your belly button, that area. It wasn't tender. It didn't feel full. I got the nurses to do an ultrasound scan as well, and it wasn't full with any fluid or anything. It was completely empty. So I figured catheter's working. So now I have to go south. Obviously, before doing anything intimate, you get someone there to chaperone you. Couldn't find any of the nurses. I reckon they were on a break. So I got a student nurse and we're in this together. And like, literally, we're like, okay, sir, can you please like pull your pants down? And it reeks. I can't even tell you what it smells like. I mean, half of you will probably lose your appetite if I went to describe it in that much detail, but it absolutely reeks. I've got my mask on and I just remember that moment. I saw a TikTok of someone putting mint on the inside of their mask, like just lathering on like a mint chewy, like one of those Mentos mint chewies. And I was like, oh my God, like why did I not take TikTok a little bit more seriously? It reeks. I'm trying to hold my breath. Do you ever find that like if there's a bad smell and you try to hold your breath, or like if you suddenly stop holding your breath and you suddenly inhale it, that it's like toxifying your system? This is not hard science. This is not a scientific rule, but I just keep thinking about these weird things when strange things happen to me. So back to the patient. I can't see any visible signs of redness, but he's complaining of pain. He's got his foreskin hanging out. Not a particularly amazing sight to see. So my best friend taught me this trick. I ask him to retract his own foreskin because here's the thing. I don't want to be too forceful with it. And if you see me play badminton, you'd know I get a little bit aggressive when I'm playing sports. So I literally tell him to retract it on his own. And he does so a little bit. And I tell him, oh, like, can you like go past a little bit more? And then he's like, oh, it burns. But he's able to do it. So I take over and I like check his testes first. As I said before, wasn't red. I could feel it. And then I help him retract his foreskin. And literally the smell is intensifying. He didn't have phimosis, and basically what it means is that like the skin is like narrower, so you can't retract it back, and that can be an immense source of pain. So I'm looking at the source and literally there's yellow everywhere. It looks, I don't know, infected. In my head, I'm like, this is not normal. This is infected. Is it pus? Is it an abscess? I don't know. It wasn't either. It wasn't anything of that sort. It was just some thick dick cheese. Some nice smegma all around. Honestly, I didn't even know what to do. I just looked at that. I was like, oh my God. And that was literally the source of his pain. He wouldn't let me touch it. He wouldn't let me remove it or anything like that. By the way, guys, I need to let you know, I was definitely wearing gloves for the whole thing. I'm always wearing gloves with these examinations. Anyway, I document that and I didn't know what to do. I was like, I don't know why this is such an acute thing. It's 3 a.m. and I'm just mortified, honestly. Like, I'm just literally questioning if I'm paid enough to do these things. So I bleep urology. I could tell the reg was fast asleep. I don't know why that's the case. I feel like they probably don't have that many urology emergencies, so they probably sleep well at night. I wake him up. He's like, are the vitals stable? Does he have a fever? You know, the basic, like, danger questions. Okay, fine, he's fine. I'll see him in the morning. And I'm like, yeah, but he's in so much pain. And, like, literally by this time, the urology registrar hangs up on me. So it is what it is. So I gave him some more pain meds. I gave him ketoconazole because I thought it was a fungal infection. And then I left a note for urology to strongly recommend him to look at this bloke. And that was it. So I went back to the wards this morning. We had a ward round and I kid you not, guys, I could not look him in the eye. Like, I know it's normal, I know it's part of my job, but like, I feel like he knew that I couldn't do anything for him. He knew that it was the urology consultant and the urology team that did something. And to be honest, I couldn't follow it up either. He's fine now. It's just extremely awkward.